Soto here, along with George Batista. As always, welcome to Counterparts, where we spotlight conversations on creative minds, inspirational minds, and people that are doing stuff. George and I were just talking about that. We love people that are doing stuff. And today we have Barbara, and me and George we're practicing the pronunciation, and she's gonna correct us. But DiPietro. Hopefully that is correct. We're gonna ask her, but Barbara's gonna be on today. She's gonna be talking about a lot of things having to do with homelessness and her work, her amazing work that she's been doing for over 25 years. And we're very excited to have her on here. So please come on back and stay tuned because it's going to be a fun one. All right. Thank you, everyone. I'm so transparent. I just say the pronunciation. I could have just said it and not said anything, right? But no.
Yeah, of course. But but you're you.
I have to. I'm me. So, George, thank you very much for being here as always. And we have a sponsor that we're going to take care of. So please take it away.
Well, thank you for inviting me, John.
You're welcome.
Yes, we're going to talk about sponsors. But before I get to that, I just want to congratulate you, John. You just had a film, right, that actually was nominated at a film festival. Did you just mention that for a second?
Yes, thank you. I appreciate that. Yeah, it was at the Nashville Independent Film Festival, and it's semi-finalist for original narrative short. So I'm very excited. So thank you. I appreciate that, dude.
Absolutely. Well, congratulations to you, sir. Job well done on that. All right.
Thank you.
All right. So, as all of you know who watch this show, the Counterpart Show is brought to you by Wellness Resources, a family-owned and operated nutritional supplement company providing the highest quality, clinically formulated supplements since 1985. Find out why Wellness Resources supplements are the top choice of guys like me and health-conscious individuals around the world. Make sure you go to myvitaminresource.com. And if you enter the promo code Counterparts, you will get free shipping on all orders. So make sure you check it out. All right, so let's talk a little bit about our guest. We're very excited to have Miss Barbara DiPietro here today. So a little bit about Barbara. She's been working in healthcare and homeless policy for 25 years in both the public and nonprofit sector. She holds a master's degree in policy sciences and a Ph.D. in public policy, both from the University of Maryland, Baltimore County. For 10 years, she worked for the state of Maryland and the governor's office, as well as the Department of Health, helping coordinate health and human services policy and legislation, interagency children and family service, and the state's 10-year plan to end homelessness. For the last 13 years, she has been the Senior Director of Policy for the National Healthcare for the Homeless Council. And in this role, she focuses on national policies that advance the human rights to housing and healthcare and end homelessness. She is based at the Healthcare for the Homeless program in Baltimore City, and we are very excited to have her on the show. It's going to be a great conversation. So, ladies and gentlemen, without further ado, Barbara DiPietro.
Right. Thanks, guys. Thanks so much for having me.
All right, welcome. Thank you so much for doing this. Appreciate it. It's always intimidating when there's someone that's very smart on the show.
Oh my! Let's operate under no illusions there. Don't ask me to do a math problem.
Me too.
Wait, no. Yes, 2 trains leave a station, I immediately melt. Oh my god!
I can't even help my daughter. I can't help my daughter with her homework. So forget about it.
Well, that's comforting. Thank you. I appreciate that. Thank you so much for being here and taking the time to join us. This is an honor to have you on here. It's something that I work with the organization that you're with as well, the National Healthcare for the Homeless Council. And it's always been it's an honor for me to participate in the meetings and to hear, because it's a new space for me, so I'm learning so much about what's happening in that and having different perspectives and hearing everything. It's just really a great to be on that side of it now. So I'm very, very excited for our conversation. What I'm going to do is I'm going to turn it over to Mr. Jorge Batista, my cousin, and he's going to start us off with a question, and then from there on we're just going to rock and roll.
Okay.
Absolutely. So again, for those folks who are not familiar with you, I want to start out with how you got started in the industry. Let's tell us a little bit about your background and kind of go from there.
Sure. Well, which industry? In healthcare or in homelessness? There's a lot of
Well,
industries.
that's either or.
Yeah, well, both, I guess.
No,
Well,
both, yeah.
let's start with healthcare because that came first. But really,
Okay.
an accident, like a lot of people, you had no idea what you want to do in life, and you tumble through until it all kind of starts to click. And some people know what they want to do from the day one, and I had no idea what I wanted to do still, even when I graduated college. But you find yourself taking jobs that you wouldn't have thought of. I ended up working in chemical weapons destruction for
Oh, wow.
a contractor in the U.S. military, and
Wow.
found myself at the age of 24, with a secret clearance and working on, like when you end up being an editor, and nobody thinks about this kind of stuff in the
Yeah.
industry. That all the people with secret clearances are like the uppity up. But think about the word processors like me, the editors, the people who empty the trash can. They all have to have a secret clearance to be in these spaces
I
sometimes.
never thought about that. Like
Okay.
Iron Man and his and that
Right.
whole thing that he does. You have to have clearance to get in there. You can't just walk in, and
Yeah.
no matter
So
where
this
you
is
work. That's
the
so
kind of
interesting.
thing that you find yourself doing, and then you're like, wait, hang on, this isn't what I wanted to do. And I always had this idea that I wanted to go into the Peace Corps. And
Oh,
so I was like, you know what? I'm going to stop the ride. I want to get off. And so I ended up going into Peace Corps and doing maternal child health in Southeast Africa in the country of Malawi. And while I was there, I delivered babies and did immunizations and lived in a little village with a family that taught me everything and stripped away my illusions of what privilege was. And I really saw
interesting.
with new eyes what poverty looked like and what real need was in the world. And this was really eye-opening for a white suburban girl like me from Harford County. This was wholly new. And so, yeah, that's where you kind of just tumble into what you thought you wanted, and it ended up being a whole lot more.
Wow, that's amazing. My wife was in the Peace Corps. She was in Kyrgyzstan.
Oh, okay, a very different
Yeah.
experience from Southeast Africa.
She taught English there, and
Mhm.
yeah, she's got some stories of that. You do get a completely different perspective, and she tells me these stories, and I'm like, holy cow. I mean, we don't realize. I mean, I do. I guess as you get older and I've been through certain things myself, so you do kind of appreciate and you do understand certain, but there's another level of it that you
Yes.
just cannot comprehend unless you're really there.
Right. I mean, yeah, my family had struggles, but it's all in context in comparison to what?
Right.
Yeah.
Yeah.
Exactly.
Wow, it's
So
amazing.
yeah, from there it ends up being that you end up better understanding public health and social determinants of health, and what poverty looks like and what are the structural influences to all of this. And my mind started working a lot more, so that when I came back, I really purposely put myself on a path of working in healthcare and human services. And you tumble into political service by accidentally applying for a job at the governor's office as like an
Wow.
assistant to the governor, and weirdly, without any political work on his campaign, I got the job, and boom, this is what sets you in another direction of politics and public service.
Wow, that's amazing. And
Yeah.
did you just yeah, you're right, because you don't realize it. I mean, I don't know if I really know what I want to do yet. So
Right,
I'm
it's a
still
whole journey.
Right.
I'm still searching, but I mean that's what life's all about, right? Is about living and
Yep.
experiencing things and then running into things and be like, oh, that's interesting. I had no idea. And then going in
Yeah.
that direction, and you follow your heart. When did you was that something that was at an early age? Let's go back. Let's go way. Let's go back. Well, at an early age, did you
Am I going to be
feel
telling you about my relationship with my mother?
Yes.
you have a
Yes. Let's
couch you
talk,
can lay
let's
down
talk
on?
about that. I have my pad ready. Let's talk about that.
So, but is that something that what was your experience, when you were growing up? Did you have any type of awareness that you wanted to go into that type of industry at some point, or even just the purpose to want to help?
Looking back, no. I was not oriented to social justice growing up. Through high school, though, it probably doesn't surprise you to know, John, I was a little bit of a geek in high school, and so I was on the debate team. And so this is where you like really learn to educate about serious issues. And it's there that I was just like, wait a second, there's really some issues that are important. And so, but the idea of service or how you could really operationalize that as part of a career, I don't really think I knew about those kind of careers and advocacy and service like that. It just wasn't something that kind of, really struck you as an area that you could grow into as a job.
Yeah. So it really was the Peace Corps that really instilled that understanding of the need that you can,
the need and the possibility for change also.
Right.
How is it that you can organize and affect change, even in small ways?
That's interesting. Sorry, George, I know you have a question. We do this a lot. I just start rambling. So I lived in Bayonne, New Jersey for about 9 years, and I worked with some of the political figures there, and I worked on their campaigns and stuff. And you're right. In small ways, it seems like in a big ways, it's like you can't see big change because you're talking about, we're spending $400 trillion on this, and I'm like, what? What? But when you really can be in there, you can actually see change. Like, okay, we need this park fixed because kids can get hurt, and then suddenly people gather, and then there's policies, and then people write things, and then money comes, and then the park gets fixed, and now we have a park. And those kinds of things are really exciting. Do you remember when you actually were in there for the first time and you saw an actual change on something that you contributed?
Yeah, it was when I was in Peace Corps, and the rains would come, and I worked at a health clinic, and so there were no beds, and women and their children would literally sleep in puddles, and it was crazy. And then we wondered why malaria was so endemic. And so I wrote a grant and got some beds, and we worked with a local welder, and the welder built a bunch of beds, and we were able to improve the conditions of this clinic. And it just seemed like such a very small thing, but yet very tangible to the 15 women living in that ward.
Yeah, and probably they probably had tears in their eyes when they saw an actual bed. I mean,
I hope they were able to rest better too. We were able to get all new mattresses and bedding, and that actually ended up being from the Lions Club International.
Wow.
So, yeah.
That's incredible.
Amazing.
A little plug for Lions Club International, by the way. They gave a Peace Corps volunteer who literally was writing them a letter on, if you'll okay, are you guys old enough to remember?
Yes, I'm sure I am.
Paper, and you would write a letter. Okay,
yes,
right.
Yes,
so just actually mailed letters where you would write out with carbon paper with candles at night. Like this was what you did in Peace Corps. And things that aren't in the brochure, but there are charities out there that will actually work with you, and you can see real tangible things at that level.
Yeah, that's awesome.
I always wonder with somebody who goes to Peace Corps and who does stuff like that. Was your family supportive of it? Did they think you were crazy, or did they think it was amazing? What kind of support did you have?
It's funny. My father did not understand why I was quitting a perfectly good paying job to earn nothing by going overseas to work in a country that he had never heard of before. So and he was just so excited that his daughter, who had gotten an English degree, which he did not think was a very good idea, was actually gainfully employed. So he did not understand this was a very logical step for me. My mother, though, had done a volunteer project with the Catholic Church when she was a young nurse. And actually, she really kind of credited herself as being the one who instilled that desire in me.
Yeah. Oh, that's great.
That's awesome.
That is like so important though. Cause I was thinking about like, if I told my grandparents raised me, I think my grandmother would flip out. Wait, you're doing what?
What and why? What are you doing?
Yeah. She got mad when I moved to New York with roommates. She thought I was so I was like, do you have a question, George, or can I go on?
Go on. But it's true though. If you think about it, like you think about that because we're taught, okay, you got to get the job, you got to get the degree, you got to get this, and then all of a sudden you do that. And I know my mother would have been like,
Yeah.
What? She would have been flipping out.
But I think it's also purpose, like I remember when I moved to New York and by New York, I mean Manhattan. I lived in the Bronx, still New York, but Manhattan was like another country. And when I moved there, I remember it was purpose, it was something that I was really passionate about. I wanted to be there. I wanted to be where the music was. I wanted to be where there was things happening. And it was just something that I knew was the right thing to do, and
Right.
I knew that I was going to go from a home where I didn't have to pay a lot of money because I was living at home to where I had to work, sometimes 3 jobs at times, to just to pay the rent. So the purpose is really a huge thing. And I want to touch upon that a little bit.
Yes.
There's so much, there's a balance. I wouldn't even call it a balance. It's somewhat like a divide. When you look at what's happening on the news and what's happening in certain, and then I'm on social media, so I'm working on social media platforms. Then I go to TikTok and everybody's just dancing. It's like, I'm like, don't you know what's going on? And it's like, and they have like 10 million followers, and they're not really doing. And it just boggles my mind on purpose. Like, what can you talk a little bit about that, just from your experience on dealing with so many people in policy on purpose, and how it changes from individuals, and what do you gravitate towards?
So yeah, interesting to ask about purpose, this idea of how are people driven in their work and where do they find passion?
Right.
And it's very interesting where one person's passion is not necessarily the other's. And so, you find yourself gravitating toward people who share the same passion as you, or who are in passion-driven work. And I think it does tend to certainly gives you the fortitude during difficult times like I feel like we're in now. And I think when you talk about TikTok and you talk about like this idea of like all these people are like living their lives and having a wonderful time when there's a peril going on, and hey everybody, do you see what's going on here?
Yeah, right.
But yet human beings have an immense capacity to be able to separate themselves out from either there's a level of denial, or let's face it, even people who are working on the front lines of social justice every day, we know how to party and let go.
Right.
So, how is it that you're balancing and finding the idea of like every individual will find their own calibration and how much passion they can work in without needing to have that balance of fun and frivolity. It's hard doing homeless healthcare work. And you've got to be able to bring it up and toss it off, because otherwise, it tends to bring it down. It can eat at you after a while.
It can. Yeah. And also the purpose has to be, you have to be able to do that, make that split and kind of separate yourself, because then your purpose gets more defined. It becomes this one thing. You become that thing, and then you're kind of like not knowing where you're going. But if you really are able to kind of like you said, you got a party, but now it's time to work. Then the purpose becomes more clearer, and you're like, okay, now I'm at work. And it's sort of like when at our events, our conferences, and it's like you see everyone like really driven, but everybody's having fun. I see the email, where we're going back and forth. You have to have that in there, or else you can really lose it.
Well, I think really the central question is, how is it that we find joy in the struggle for justice? And so, so what you described, like at our conferences, finding connection, like, isn't that purpose? So whether that's connection in your friends while you're hiking, or whether that's connection in the work that you're doing during the day, it's how is it? And so we got philosophical really fast. But if we talk about like
we do that here.
We do that, right? So like when we talk about finding purpose, what if purpose is our human connection to each other? Whether that's in the work, or in the joy, or in both. I think that's the secret to finding the sweet spot.
Yeah, that's actually, I wouldn't say a trick, but that is where you want to actually find. That's the goal to get to. That's awesome.
But it's interesting though, because if, like, for example, take the last 2.5, 3 years that we've been through, right? Probably more people now are finding purpose because of what we've went through than prior, right? Sometimes it takes the things that happen in life, or in society, to say, what am I doing?
Yeah.
And
Yeah.
life is fragile. Life is brief. I got to get to what so I think even for John and I, we started this show during the pandemic because we were like, you know what are we doing? Let's do something together. So some part of that also comes from this thing. Like I say, and unfortunately, like I'm in healthcare as well, especially as a health coach. And I see people who come to me only when they've had a diagnosis of something. Right. But meanwhile, before that, they would never touch me. They wouldn't call me at all. But as soon as something happens, then they call me. So a lot of people sometimes get driven out of that, right?
Yeah, I think we've had a lot of people on the show so that get challenged. We're challenged, and even not just during the last 2 years, but in their lives, there was a moment where something happened,
right?
Where they hit something and they just decided, "Whoa, what's happening here?" I've had like at least 3 or 4 of those in my life. Where you're like, man, you got to wake up, because you get into this workaday world, and you're just getting up, you're going to work. The next thing you know, you're like, "Whoa, 2 years just went by and I'm miserable. What's going on?"
Being forced to reevaluate.
Yeah,
is an opportunity for something new.
Absolutely, that's awesome. So yeah, we do get philosophical here.
Oh, very good.
Yeah, we love doing that.
Yeah,
that's deep.
So I wanted to ask you, it's very difficult to talk about these subjects without getting into the political world of it, which we don't do on the show, but it's very difficult not to, at some point. Is there something that you feel is not covered enough on both sides of the spectrum, like something that you think in the healthcare and in the homelessness space? Is there something that you like, nobody talks about this?
One thing in the idea of what, let's just say, the left and the right. So the right doesn't talk honestly enough about how our healthcare system is financed and the pitfalls of how we do it right now, the wastefulness that they say that they're so against, and all of the, cognitive dissonance and even, I'm going to say hypocrisy on that side. Right. At the same time, I think that the left is also not honest with all of the ways that our healthcare system would need to change in order for that to happen, and is not honest enough with some of the struggles that a new system would inherently bring. And so at the same time, there is no having a discussion anymore that feels constructive and based on reasoned thought. And so we've kind of retreated to these polar sides that I think obviously end up being tedious for everyone and not constructive to moving us forward.
Right. I'm going to ask you, have you ever thought of running for office?
Only when my husband and I joke around, because DiPietro is actually an old school political name in Baltimore City. And so we've often joked that either one of us could run for office, and just the name alone, recognition. But I have to say, one of the key reasons I would not be interested in running for office, one is I'm far too opinionated. And when you're a political figure, you really kind of have to do that kind of little dance. And I wouldn't have the patience for that. Right. So I would last like 2 minutes, and then I would say something, and then so then it wouldn't work. Right. But you know what? The campaign fundraising is enough to make the whole job miserable. And this is one of the things too in our system that would need to change, in my opinion, is there's holding office and representing your people. And then there's the money fundraising part of it. Yeah. And sometimes you're good at representing people and terrible at fundraising. Yeah. And then that means you're not getting reelected. Sometimes it means you're really great at fundraising and terrible at representing your people. And those folks get reelected.
Right.
So that's part of the problem too, is how we finance our public systems of voting.
Yeah. Maybe education, like, I don't know if it's really taught enough in high school to just how the political system works, so they can get those skills of fundraising and being able to operate as a figure, somebody that for the people.
But and what you think about, like, as civics, probably what they called it when we were going through.
They used to call it,
so much of that, but when you think about this, what is the conversation around what our children are learning in school right now in this country?
Right. Yeah.
So like that's a whole,
whole
you
other
know, of its own. And so but yes, to your point about how do we teach about how government works?
Yeah.
And one of the things that I learned when I was working for the Maryland governor is one of the things you learn is that when you're one of the special assistants, you're the one who does a lot of the constituent calls. So when people call in all pissed off about something, I want to talk to the governor, they get routed to people like me.
Okay.
And so I'd be like, hello, well, Governor Glendenning's office, can I help you, kind of thing. And people didn't understand what the governor even did. So they would call us with their Medicare issues, for example. And you would try to explain to them, oh, let me connect you to the federal office that handles this. No, I want to talk to the governor. And when you try to explain to them what the governor can control and can't control,
right.
And over and over and over. And this is just like one, hotline into the governor's office. But when you don't know how the system works, you can very easily be led to believe anything.
Right. So education is always a really, really key factor.
It really is.
Really
and not even politics, but just structurally.
The structure. Yeah. How things work. How
how does government work? Right. Executive branch, legislative branch.
Right.
Remember how a bill becomes a law. And
I was going to say, from PBS to school. Yeah, exactly. I was just thinking about that. Yeah. I mean, I remember watching that as a kid and remembering that.
Yeah.
But it's interesting because my daughter was learning. She's 15 and she's learning all that stuff in school and stuff like that. And I was watching her do her homework and all that type of stuff. But then you think about it, like when I learned that in school, okay, fine, I went through and I learned that. But then one of the things that you get swallowed up in is media. You get, people get swallowed up in media, and all of a sudden that kind of goes out the window, and it's everything that media says that the government is, or whatever, the right or the left. And all of a sudden that, and then that is more of an influence on your voting decisions and your decisions in general than what you learned in school, right?
Yep.
It's a little bit crazy.
Because even that Schoolhouse Rock song was just how a bill gets
becomes a law.
That's it. There was nothing in it. There was nothing in it leaning in any way. It was just how a bill gets a law.
Maybe we should make another song on what comes next.
Exactly. It should be a long song.
I'll get my guitar. Hold on.
We should write it. Good.
No, it's true. It's true. It's sad too, because I know that there's a lot of young minds out there that would actually really eat this up and really understand it and duplicate it and be able to go out and really make an impact rather than being, directed or kind of maneuvered into an area. So that's always something that's kind of annoying. But if you do decide you ever want to run for office, I did social media for three different campaigns, all won. I'm 3-0. So
nice.
Give me a call.
It's hard being an elected. It's hard being in public office. Listen, I don't envy people who don't have any privacy. Oh my goodness. Even just look at what happened to Nancy Pelosi's husband. I mean,
right.
I mean, it's a crazy world out there now.
It's crazy. I was in offices and in meetings and listening to what was going on, and I would be there for the actual conversation, and then you go out and then there's something else being put out there, and I'm like, wait a minute, no, I was there. That's not what happened, and that was part of the reason why I was actually an elected committee member actually for a term, and I left because I thought, I have a family, and I didn't want my name got brought into something really ugly at one point. It was posted, and it was like a complete lie. It was really over the top, crazy, and I thought, wow. I said, this is what it is, this is part of the game, unfortunately, and so I just decided to bow out. But all right, that's enough of that. Don't get me started. So
I'm good to be staff to elected officials. That's what I'm doing.
Yeah, that's what I did. Yeah, I did that. I did the social media. Right, I was behind the camera. I was like, so that was totally doable. I want to ask you a little bit about your current position now. What's one of the biggest challenges that you run into?
Oh, wow. A lack of hours in the day to tackle everything that needs to be done.
Wow.
But I think that probably is not a unique problem.
Right.
So,
Yeah. Yeah, I think probably, yeah. I mean, I guess when that's the actual problem, healthcare, homelessness, it's a big task, what keeps you up at night? Like, you're like, oh, I have to get, like, this is the one thing that I know I have to get done.
oh, that task-oriented things that don't keep me up at night. What keeps me up at night is worrying about the policy direction of the country.
Policy direction. Yeah.
Yeah.
Wow.
Yeah.
Wow.
That keeps me up.
Yeah. And I mean, I grew up in the Bronx, and I remember what was happening there. I did experience homelessness as a teenager. So I had that, understanding. Policies just seem to be more helpful. I don't know if that makes sense, but I just remember, and I'm not going to talk about specific times because they're still kind of difficult to talk about, but there were times that I remember someone there helping, in that there was a program, and I went, and my mom went, and my brother and sisters, and we went, and we got the actual help we needed that day, and we were able to go back home and be able to eat and be able to, and it was a quick thing. Now I'm not saying that's gone. I don't know if that's gone. I've been out of, I left there when I was 21, 22 years old, and haven't really gone back into that world. But talk a little bit about policy. Talk a little bit about how that's structured for you, and how do you, what are those challenges? Like, what are we looking at right now? Because it looks, I mean, if you turn on the news, well, you might as well just crash into the sun, because that's it, but what are you being there on the ground, seeing it? What are those, talk to us a little bit about that.
Sure. I think one of the biggest things is the battle over health insurance. And so Medicaid is really the biggest health insurance program that we care about because it covers the folks who are poor. And but you've got very different views about the future of this program, whether you're in the Democratic Party or the Republican Party. And so right now, as we're battling over the midterm election and control of the Senate and control of the House and all of that, even though you've got a Democratic president, when you have Republican control of either of those houses, and you change from a Democratic leadership to a Republican one, there's a lot of things that will change along with that because they're going to bring in a different agenda. One of those agendas is to fundamentally change Medicaid. And for the people that we serve, people in the healthcare for the homeless community, that's not going to be in their best interest. So that's one of the biggest things that we're trying to advocate against and really build support for Medicaid, because fundamental changes to that program would really be catastrophic for folks.
Wow. That's
unbelievable. Is there any specific things that you're looking at as far as changes in that direction, or?
Yeah. So right now, Medicaid is what's called an entitlement program, much like Medicare or Social Security or food stamps, something like that. And and then every state gets a certain percentage of money from the federal government, and then there's a certain percentage of money from the state government, and that makes it whole. Some states pay more than others, depending on whether they're wealthier or not. But at the end of the day, you've got money comes in. You've got so many people who are in your program. You get money for those number of people in your program. The policy direction that's most concerning is turning that into a block grant, which means that states will get a check at the beginning of the year that says, well, this is how much money we're going to give you for your Medicaid program. You live within that. Now you think about your own household, and you think if someone writes you a check on January 1st for your projected costs for the year, who knows what could happen?
Yeah,
so this is the kind of thing where that would really put states in a bind. And then as a consequence, they wouldn't be able to have enough money to cover as many people. And we all know what happens. That means you got to cut all the rolls. And that means you got a lot more people who are uninsured. And that's why changing it to a block grant fundamentally unstructures the financing to it. And then, of course, you might remember back in the last administration, work requirements. So the idea that we condition your health insurance and essentially your health care on having a job. But we know that when you're too sick to work, it's hard. So you see how that undermines the program. And so these are the two big things that we're really worried about should there be a change in leadership in either the House or the Senate.
Yeah. So like I said earlier, I remember having help and being, the Medicaid and getting that assistance. But there was also another thing that I remember getting also, and that was sort of counseling. There were people that actually care. There was a legal aid woman. I'll never forget her, but she helped us. She saved our apartment. She told us where to go for food. She also directed me to a school that I can go to, because I was out of school. I wanted to go back and get my equivalency and go back into school. She gave me that information. She gave me a packet. I remember it was like, and I had all this stuff, and it actually was really helpful. I did go back to school. I went to college, and I got, I did that route because she took the time. And I don't know if those positions are there now, because I was only 15 years old. I was a high school dropout, and my brother and sisters were younger than me, and because of how challenged my mother was, she couldn't really handle things at the time. This was a huge load off her mind that I took it, and I decided to run with it, and I applied for my Pell Grant, and she helped me because I didn't know what's my social security number. I have no idea, so she helped me with all that, and it really was a help. But this woman was, there's a dramatic story that at some point I'll tell in somewhere, but there's a whole dramatic story about it. And when she helped me, I remember always thinking, I'm so glad that this is there, because the help has to be there for young people to be able to grow up and be able to take responsibility at some point and say, okay, I can do something. I can be something, here's my opportunity. Do you see that within these programs? Is that still something that you see happening?
Legal aid is still certainly a program. But like most social safety net kinds of programs, it's woefully underfunded. And so you've got, and also very locally driven. So particularly when you talk about school resources, all of that's predicated on a lot of local school funding, local school resources. So your question about whether school counselors still exist. Yeah, but when you look at how they're distributed and who gets access to school counselors, you get the counselors, at schools here in Baltimore City, they might have like a caseload of 500 kids. And you go up to the county and you've got, really nice school systems. You might have one counselor for every 10. So, a lot of this is just dependent on where do we put our resources and who benefits from those resources. And we all know the answer to that.
It's really not fair.
Oh my!
Let me write that down, because
write that down.
I'm going to make sure that I write my next article. It really is frustrating though, because anyway, it's frustrating. George, do you have
frustrating?
Yeah, no, absolutely. I completely agree. And we had Bobby Watts on this show, and we had a great conversation with him. And one of the things I mentioned to him, and I want to kind of mention to you as well, we're talking about homelessness in general, just kind of going back and forth on. And one of the things I had mentioned to him was that I had done some research. Well, first of all, I thought about this after I went to LA. Okay. I went to LA for the first time and really saw what was going on there.
Oh, it's quite
and that
shocking,
was a lot.
isn't it?
Yeah, it shocked me. And my wife as well. We came back like, wow, and then I started kind of really doing some deep thinking. And this was way before we were even going to do this show or anything like that. It was just, I started doing some research. And one of the things that, we talked about was getting help for, substance abuse and that type of thing. And there was this whole notion, there was kind of a back and forth when I was watching, especially documentaries talking about, should we help folks with substance abuse problems before we provide shelter, or should we provide the shelter first before that? So I wanted to kind of get your thoughts on that.
Sure. I would say that the goal is not shelter. The goal is housing. And
Correct,
so,
right.
So when we talk about housing, really, it's the cost of housing that drives homelessness. It's not addiction. Plenty of people with substance use are housed. with
Right.
mental health as well. Like those aren't the issues. The issue is not being able to afford rent. So the issue is the difference between what people earn and what rent costs. And what you're looking at in LA and in California, you know, it cost $500,000 to build one unit of housing, and that's like at the minimum level.
Really?
$500,000 just for one unit. So when I see, you know, they pass these tax measures, oh, we're going to set, you know, $3.5 billion aside to build housing. I think, well, at $500,000 a clip, that's not going to take you very far.
Yeah.
And
right.
so when you make the cost of housing so ludicrously unattainable, of course you're going to have people who were lined down every street. It's a shocking violation of human rights.
Yeah,
and
absolutely.
we allow this. These are all conscious public policy decisions. We choose homelessness in this country. I mean, it's not an accident.
Well, when you look at the first two states, California and New York, right? There's number one and number two in homelessness, and they're two of the most expensive places to live.
Yep.
You know, and New York, just looking at numbers recently, New York has the highest rate right now since the Depression, since the Great Depression, has the highest rate of homelessness. New York City, it's crazy.
It's crazy. And when you look at where most funding for housing comes from, it's the federal government.
Right.
And what have we had over the past several years? We've had an administration that did a lot of cuts, and then a Congress where we haven't been able to get any increases through. If you'll remember the Build Back Better package that the administration was, that had $150 billion of housing in it. That would have been one of the single largest investments in housing that we could have really built a lot of units with that. But it never made it in because we can't afford it. And so we have nothing. And so what we continue to do is we have rents that continue to go up. We have wages that are rising for some folks modestly, but for a lot of folks have been stagnant. Right. And so again, it's the difference between what people earn and what rent costs. And we're not funding any of that in the middle. So that's why we've got home. So this is where, you know, when we talk about addiction being the issue, that's a red herring. And that takes our eyes off of what really needs to happen. It's in housing. It's not. Now, obviously, we need to be changing access to treatment. You know, only one person who has a substance use disorder is in treatment, and 9 people are not. And that's largely because we've made it really hard to get treatment, and we've stigmatized the hell out of it. So, you know, God forbid you would want to, but not really be able to because your family disapproved or what have you.
Wow.
Exactly.
So yes, so not to disregard those issues, but really to bring the focus back to the cost of housing.
Yeah.
And, you know, being from New York, you know, I remember I just got lucky and got into an apartment that was a rent stabilized apartment.
Oh, nice. There you go.
And it was in a fancy doorman building, actually.
Oh.
Tina Fey lived there, by the way.
Very fancy.
Yeah, it was. And
moving on up.
One day, but one day, there was a piece of paper on the hallway, and I picked it up, and it just happened to be an opened rent thing. I knew somebody, one of the apartments there. It was $12,000 a month what they were paying in the building that I was living in. Now this was back 15 years ago, 20 years ago. No, actually 20 years ago, because I wasn't even married. So 20 years ago. 12,000, and I just remember thinking, what could those possibly be today? Well, I know what they are because I'm a real estate agent in New Jersey, and when I was renting apartments for $6,000 a month, 2-bedroom apartments. It's just obscene.
Yeah.
And the audacity that anybody would charge that, and not even that, but the audacity that somebody would even pay it. I'm more upset with the ones that pay it than the ones that, because if they built it and they would come, okay, fine. But why would somebody pay that? You know, and it doesn't seem like it's getting any better despite things not improving financially for individuals. And that seems to be the really frightening thing. And this is why, you know, I tell my wife, you know, you got to put some money aside. You got to get a piece of land. You got to maybe build a little shack, just because I feel insecure overall and I have been homeless. So I guess I have that thing, you know, and I've told my wife, I said, listen, if I have to grab that guitar and sit in the corner and play for 12 hours a day, I will do it just to avoid not having my, my kids not have a home. I would do it. Can you talk a little bit about the education that we're, because in part of the National Healthcare for the Homeless Council is part also education, right? And that education in building, in what you were just saying, how can we better educate individuals on what's currently happening? Because it doesn't, like our show, right? You've said about 10 things today and I'm like, holy crap. I'm like, why isn't this on the news?
Right.
Like
Right.
every day, why are we listening to whatever's happening on the news? How can we better educate as a council?
As a council?
Well, just as those that are in the know.
I see. I think a lot of this is really making connections to the issues that your friends and family are probably already addressing. Like struggling for rent is hardly a unique feeling to a lot of folks.
Right.
And so it's this idea of, I think, how is it that we see commonality in the struggles that we have? There's a lot of people who are struggling to afford healthcare, and not all of them are poor.
Right.
There's a lot of folks who are worried about making mortgage next month. They understand, they should understand struggle, even though they're not a renter. And so this idea of, being unstable, feeling precarious, not knowing what's going to happen next. These are hardly unique feelings across lots of different groups in this country. Right. And I think one of the things I would love, we talked about this idea of purpose and connection to others earlier. Right. And one of the things that I really think can help us move through the sea of noise is really having authentic connections to other people and just say, I see your struggle and your struggle is also my struggle. And I think too, and I think to put a finer point on it as well, is, and if I have caused some of your struggle, then how is it that I can take responsibility for that? And so, having these conversations, and I think particularly as a white woman, in a space where we need to be anti-racist. It's not enough to just, say, oh, I'm a decent person. You've got to be working toward ownership and responsibility. So I just think having more honest conversations where we're reaching people where they're really having authentic feeling, and then connecting our struggles so that we see, hey, we are all wanting the same thing for ourselves and our family. And how do we transcend that? So I'm sorry if I went like too philosophical on you.
No,
absolutely.
We love this. This
is yes, we get in there. Yes, absolutely.
But yeah, when you think about like how do we educate ourselves, I think we educate ourselves by paying attention and listening to each other.
Yes.
And then connecting. What is it that we want, and how do we move forward in a collective way that doesn't feel adversarial, where there's this idea of just your loss has to be my gain, or my gain has to be your loss.
Right.
And how is it that we kind of change how we relate? Oh, I'm terribly philosophical. This is what happens when you get me close to 9 p.m. I get philosophical.
No, this is awesome. This is what we love. And at the end of the day, it's always going to be connecting with people. I mean, that is why we're on this planet, and we talked about purpose a lot on this episode, which I think is really great because, George and I talk about this also, at the end of the day, when I take that last breath, I want to be able to say, okay, my life meant something. There was a meaning to it. I left things better than when I arrived. I created
the campsite
something.
Rule to life.
Right. And I just think that to me is really, if we could instill that, into the conversations that we have, like you said, and really get in there and really know what that struggle is. And, we can't always just know exactly what everyone is going through. We're all individuals, but we can definitely dive in and get as much as we possibly can to really make a well-formed idea of something that we want to contribute to, some type of platform that we could really contribute to. And I think that for the most part, people want to help. You see people that want to help, but are they helping? And do they know how to help? And I think that's also something that falls under education. It's like, well, you want to help, go vote. You want to help? There's a soup kitchen every Sunday that needs people. They're you want to help? do that. You know what I mean? Those kinds of things, and maybe even have a list on a website. Wannahelp.com, and people just go to this and they could just click off things and it'll go here. This is in your location. We need somebody here. And I think that provide that connection that you're talking about, because that is really the only way we're going to come out of this. It's us helping each other, helping others. Wow, that's.
And I think being engaged to speak truth to power too, because I think a lot of this is about people claiming power that they have not previously claimed. And I don't mean just like voting. We're coming up in the midterm election. You know what? About a third of eligible voters generally vote in a midterm. The world is run by people who show up, and people who show up to the polls specifically. Yep. So it's the kind of thing where, this engagement in your community and not stopping just with voting, but how are you participating in interaction with your elected officials? Do you write to them? Do you even know their names?
Right.
The people who decide what your life is, you should know who they are.
Right. You should.
And so, hey, everybody, there's an election coming up next week, if you haven't heard. And and a lot of states offer same-day registration, and voting. So check your rules, but please turn out, because there's a lot of things that really impact people's lives.
Yeah.
And not just federal, but lots of stuff.
Right. Mm-hmm. And study the issues.
Yes.
Going in there.
Yes.
It's like study the candidates. I learned that when I was in Bayonne, because I was like, oh yeah, this person is for this, but wait a minute. That person is not for, wait a minute, hold on. They're on the same ticket, but they got two different, hold on one second. It's like, and you educate yourself, and then you can make a really a good call for the sake of your family in the future.
People will put more thought into what Netflix film that they picked that
night. Exactly.
Their congressional representative, or their school board lead, or somebody like that. Like, hey, these are folks who are making decisions for you. They're going to have a long impact. You should know who they are, and read RTFM. Read the FM manual.
Right.
This is how our system works. You got to know the rules, otherwise the system's going to play you. Like, people aren't wrong when they're frustrated, and they aren't wrong when they think that the system is rigged against them. They're not wrong.
Right.
It's just that if you read the manual, you'll know how to fix it.
Right.
Yes.
Right. You just have a better idea of how to approach it instead of being blind. You'll have a know.
Or manipulated by others. And George, you talked about the role of the media coming out.
Yep.
And so how is it that you have a better nose for what's really going on?
Right.
Mm-hmm.
What's going on? Exactly. So, this has been, it's 52 minutes, George.
It's like this show just flies by. It's amazing.
What just happened? Holy cow. This has been really amazing, Barbara. Thank you so much for taking the time. Before we go, one of the things that we always ask our guests is at the end, again, the last 2 years have been very challenging for a lot of people. Do you have any words of, I don't want to say advice, but just some words of encouragement to our audience? Anyone out there that's going through something, how they can actually take charge of their life if they're stuck somewhere?
Purpose, right?
Purpose.
Yeah. The theme.
All I would say is that everyone in this community matters. And if you're out there and you're feeling alone, or you're feeling like you don't know where to turn, you have got an army of people who love you and want to support and help you. And how can you just reach out and engage in your community? Connect with people. We've talked a lot about connection tonight.
Yes.
And we've talked a lot about, really having authentic interactions with other people. And so how is it that we're doing that at the individual level? And how is it that we're voting and getting engaged at the community level, and really starting to see more macro level changes, as well as living our own purpose for our own individual change? So I'm just seeing this kind of individual action as well as community movement that I think we can engage in together. And I think moving through this with humility and love, I think is really going to help us be stronger in the end.
Love it. What can I add to that?
Yeah, no.
Wow. Barbara, thank you so much for your time. This has been such an honor. Please, we're at the end of our season this year, but we'd love to have you back again. And
Love to come back. George, John, thank you so much for having me. This has been such a fun discussion tonight.
thank you so much.
Pleasure.
Great.
Pleasure.
Our pleasure.
Thanks.
Have a good night.
You too.
Wow.
Well, you see, I mean, we educate, we have fun, we educate, and it's just
But that
never
last
ends with
piece, that last
that.
piece,
That was beautiful.
connection. I mean, that was just the thing to me, and that's really, whenever you talk to anybody, you can talk about people getting angry, they're all there, this and they're that. But if you don't know the policies, if you haven't taken the time to really understand the issues, if you haven't taken that time to really connect with those individuals, like she said, it's like, what are you doing? That's really what it is. It's really us connecting as humans and having that purpose, helping each other, with love and humility. It's beautiful. I love it.
Beautiful. Unbelievable.
Whew. All right. Well, thank you everyone for tuning in. We appreciate you very much. Thank you, George, for showing up.
Thank you.
I don't know what that means, but but thank you all for tuning in. This has been really a great one. We're really excited to have Barbara on here. So we'll see you all again next week, 7 p.m. Central, 8 p.m. Eastern Standard Time. For Counterparts, George Batista, I'm John Henry Soto. We'll see you. And as always,